Welcome back to my channel. This is another quiz time, and in this section we'll be looking at some questions that are related to the elbow joint. This is where we have the elbow joint. This joint is created between the distal end of the humerus and also the proximal ends of the radius and also of the ulna. I'll put up a lecture on the elbow joint. You can go and check that lecture up before taking up this quiz. The first question we'll be looking at here reads that elbow joint is classified as dash. Elbow joint, is it classified as a ball and socket joint? Is it classified as a sutural joint? Is it a cartilaginous joint or a synovial hinge and pivot joint? Which of the following options here is correct concerning the classification of the elbow joint? The correct answer here is synovial hinge and pivot joint. This is how the elbow joint is classified. Now let's move to the second question, and this reads that the ulnar ligament mainly stabilizes dash. Is it the humeroulnar joint? Is it the humeradial joint? Is it the proximal radioulnar joint? Or is it the distal radioulnar joint? The correct option here is the proximal radioulnar joint. The ulnar ligament is seen to encircle the head of the radius, and this is where it is helping to anchor the head of the radius onto the ulna. So it is seen to help stabilize the proximal radioulnar joint. This is the correct option. Now let's move to the third question, and this reads that which ligament primarily prevents vagus stress at the elbow? Is it the ulnar collateral ligament? Is it the radial collateral ligament? Is it the quadrate ligament or is it the ulnar ligament? The correct answer here is the ulnar collateral ligament. This is the ligament that is located around the medial side of the elbow, and this is where it is helping to resist vagus stress. Now let's move to the fourth question, and this reads that the nursemaid's elbow results from displacement of the dash. Is it displacement of the capitulum? Is it displacement of the head of ulna? Is it displacement of the olecranon process, or is it displacement of the head of the radius? The correct answer here is the displacement of the head of the radius. The nursemaid's elbow is an impairment of the ulnar ligament. And we know that the ulnar ligament is what helps to hold the head of the radius onto the ulna. So the displacement of the head of the radius is what is seen. Now let's move to the fifth question, and this reads that which of the following muscles is a flexor of the elbow joint? Is it the coracobrachialis? Is it the brachialis? Is it the amponius or is it the subscapularis? The correct answer here is the brachialis muscle. The brachialis muscle is seen as the only muscle here that crosses the elbow joint, and this is where it is helping to flex this joint. Hence, this is the correct option. Now let's move to the sixth question, and this reads that which nerve does not innervate the elbow? Is it the radial nerve? Is it the ulnar nerve? Is it the median nerve? Or is it the axillary nerve? The correct answer here is the axillary nerve. The axillary nerve is not seen to innervate the elbow joint, while the other above listed nerves are seen to innervate these joints. Now let's move to the seventh question, and this reads that the ulnar collateral ligament has dash bands. Is it 3 bands? Is it 4 bands? Is it 8 bands or is it 6 bands? The correct answer here is 3 bands. The ulnar collateral ligament of the elbow is seen to have 3 bands. It is seen to have the anterior band, the posterior band, and also the transverse band. We've also highlighted this in details in our previous lecture on the elbow joint. You can go and check that lecture out to keep yourself updated. Now let's move to the eighth question, and this reads that at the elbow joint, the radius articulates with the trochlea. At the elbow joint, is the ulna seen to articulate with the trochlea, or is it that the radius articulates with the medial epicondyle, or is it that the ulna articulates with the capitulum? The correct answer here as it relates to the structural events at the elbow joint is the fact that the ulna articulates with the trochlea. And this is what creates the humeroulnar joint. The humeroulnar joint exists between the trochlea of the humerus and also the trochlear notch of the ulna. Hence, this is the correct option. Now let's move to the ninth question, and this reads that the proximal radioulnar joint is a functional ball and socket joint. Is the proximal radioulnar joint seen to allow for flexion and extension? Is it seen as a pivot joint? Is the proximal radioulnar joint formed between the head of the ulna and also the distal end of the radius? The correct answer here as it relates to the proximal radioulnar joint is the fact that it is a pivot type of joint. Hence, this is the correct option. Now let's move to the 10th question, and this reads that dash runs posterior to the medial epicondyle and it is vulnerable to injury during elbow trauma. Is it the musculocutaneous nerve? Is it the median nerve? Is it the radial nerve? Or is it the ulnar nerve? The correct answer here is the ulnar nerve. The ulnar nerve is seen to pass behind the medial epicondyle, and at this point, it is seen to be subjected to injury during elbow trauma. Now let's move to the 11th question, and this reads that the elbow joint allows dash. Is it seen to allow flexion, extension, and also pronation, supination? Or is it seen to allow pronation, supination, and adduction, abduction? Or is it seen to allow flexion, extension, and adduction, abduction? Or is it none of the above? The correct answer here as it relates to the type of movement that is allowed or exhibited by the elbow joint is flexion, extension, and also pronation, supination. Hence, this is the correct option. Now let's move to the 12th question, which is the last question, and this reads that the following form the lateral collateral ligament complex except, is it except the ulnar ligament? Is it except the radial collateral ligament? Is it except the lateral ulnar collateral ligament? Or is it except the ulnar collateral ligament? The correct answer here is the ulnar collateral ligament. If you look at all these ligaments listed above, they are seen around the lateral region of the elbow, except for the ulnar collateral ligament that is positioned medially. Hence, this ligament does not form part of the lateral collateral ligament complex. So thanks for watching. Let's have your grades in the comment section.